Thank you very much, and thank you to you at home for sticking around for the next hour. Rachel has the night off, but we have got a really great show tonight. In fact, we literally have a report that will change your understanding of the fundamental nature of the universe. I am not at all kidding about that. But we're going to begin with a smaller but still pretty important question. After Republicans lost in the courts, and if they lose in November, can they still stop the Affordable Care Act? And would they even want to? Now, some say they can. They've come up with an exciting new plan to keep the Affordable Care Act from stealing all of your freedom. They will fight it in the states. Now, states can't actually overturn federal law, but they can maybe, possibly, be convinced to refuse to go along with it. And so that's what the Republicans are trying to do. Representative Michelle Bachmann has joined 12 Republican senators and 60 Republican House members to send a letter to all the governors, asking them, in fact, even begging them not to cooperate with the Affordable Care Act. The letter says, and I quote, "The Supreme Court has ruled significant parts of the Medicaid expansion of the president's health care law unconstitutional, as well as ruling the individual mandate violated the Commerce Clause and will therefore be implemented as a punitive tax on the middle class. As members of the U.S. Congress, we are dedicated to the full repeal of this government takeover of health care, and we ask you to join us to oppose its implementation." Now, a quick note on that letter. That's not really how I remember the Supreme Court ruling, because I remember them ruling the mandate is constitutional and the Medicaid expansion is constitutional, but that the federal government can't take away all of the states' old Medicaid money if they don't participate in the new program, something we'll get to in a sec. But it sounded different the way they put it. It was less this law is constitutional and more the Supreme Court said it would make George Washington cry 1,000 tears, which is a little odd. Anyway. The thing Republicans are asking governors to do in that letter does not amount to very much at all. They're saying don't set up the health insurance exchanges, which are the places in the bill you go to buy insurance. But if states don't set them up, the law just says the federal government will set them up instead. So they're saying Republican governors, don't set up the exchanges, let the Obama administration do it for you, which is maybe a pain for the Obama administration, but I have a hard time getting worked up about it. The bigger and more consequential effort here, the one I do get worked up about, is to get GOP governors to refuse to participate in the Medicaid expansion. Now, they can actually do this. States don't have to participate in Medicaid. In fact, it took Arizona 20 years after the original Medicaid program was set up to join in. And some GOP governors have already said they're going to try and sit this one out, too.
Every governor's got two critical decisions to make. One is, do we set up these exchanges? And secondly, do we expand Medicaid? And no, in Louisiana, we're not doing either one of those things.
That is Governor Bobby Jindal of Louisiana saying his state is going to pass up on a sweet, sweet deal. And it's worth spending a moment on this because it's really important to understand why. There's something weird in the design of the Affordable Care Act, something you wouldn't expect from all the political rhetoric. And that is that it is way nicer to red states than to blue ones. And the reason it's way nicer to red states is the Medicaid part. The Medicaid part of the bill works like this. Right now, states have a ton of leeway to decide who is and who isn't eligible in Medicaid. So Texas, they only cover working adults up to 26% of the poverty line, which is low. The poverty line for an individual is $11,170 a year. So you could be a single person making $3,000 a year, and you're not poor enough to qualify for Medicaid. That's part of the reason Texas has the highest uninsured rate in the entire nation. In Massachusetts, by contrast, they cover working adults up to 133% of the poverty line. Now, this is partly due to a bill signed by a former governor whose name rhymes with Schmidt-Schmomney. But leave that aside for a moment. It's a big reason they have the lowest uninsured rate in the nation. The Affordable Care Act wants to make the whole country like Massachusetts. Everyone making up to 133% of the poverty line, which is less than $15,000 for an individual, they get Medicaid. They get Medicaid automatically. Right now, the federal government pays about 57% of Medicaid's costs. States pick up the rest. And that's a good enough deal that every single state participates. In the Affordable Care Act, for the first 3 years, the feds will cover 100% of the difference between wherever the state is now and where the law wants them to go. 100%. After 2020, that drops a bit, but it only drops to 90%. So for every dollar the state puts in, the feds will put in $9. It is an incredible deal. But here's what's perverse about it. The less you've been doing on Medicaid so far, the more the federal government will pay on your behalf going forward. And that gets to the irony of the health care law. Red states have, in general, done less than blue states to cover their residents, particularly through Medicaid. And so they're going to get a sweeter deal under the terms of the Affordable Care Act. A state like Texas, they get a ton of money because there's a ton of gap to make up. A state like Massachusetts, they get very little. In fact, if you look at the 10 states that will benefit most from the Medicaid expansion, 9 of them went for John McCain in 2008. And if you look at the 10 states that will see the smallest bumps in coverage, 8 of them went for Obama in 2008. Now, one of the states that has promised to sit the Medicaid expansion out is good old South Carolina. Rob Godfrey, spokesman for Governor Nikki Haley, says, quote, "We're not going to shove more South Carolinians into a broken system that further ties our hands when we know the best way to find South Carolina solutions for South Carolina health problems is through the flexibility that block grants provide." So how are those South Carolina solutions working out? 19% of South Carolina's residents are uninsured. That is well above the national average. The Medicaid expansion in the new law would cut South Carolina's uninsurance rate among those eligible, those folks making less than 133% of poverty, by 56%. So 56% of the uninsurance among those group wiped out in one go. That is the 4th best deal any state in the entire nation will get under the Affordable Care Act. And the cost of that for the federal government between 2014 and 2019 is significant. It's almost $11 billion. For South Carolina, they'll pay less than $500 million. In the short term, then, a rising Republican star like Haley might have some reason to reject that deal. The Republican base hates the law, and one way to build a national profile right now is to win the GOP's ongoing "No, I'm the most anti-Obamacare politician" contest. But that contest isn't going to last forever. And governors also have to answer to non-Republican voters who don't want their state missing out on billions in federal dollars. And they have to answer to the hospitals in their state who don't want to be paying for the uninsured patients that end up in their emergency rooms when the federal government is offering to pick up the tab. And they have to answer to the insured voters in their state who end up paying higher premiums in order to compensate the hospitals for paying for the uninsured people who the feds are willing to pay for instead. So if Mitt Romney loses this election, and Republicans lose their last chance to repeal Obamacare, their governors aren't going to hold this line for very long. They can't afford to. And when they finally do decide to flip-flop on the issue, they're going to have an easy argument with which to do it. Just say it's going to be a way to stick it to those blue states that put Obama back in office. Joining us now is former Democratic National Committee chairman and former governor of Vermont and a physician himself, Dr. Howard Dean. Dr. Dean, thank you very much for being here tonight.
Ezra, thanks for having me on.
So your state, Vermont, has one of the highest rates of coverage in the nation, in large part due to laws that you signed when you were governor, and in part due to the Medicaid provisions in those laws. So is this Medicaid bill a good deal for Vermont?
Not particularly, but we think universal health care is a human right. So we've had it for children for about 20 years using Medicaid. But Bill Clinton gave us a waiver so we could do that. And we've also had guaranteed issue and community rating for about 20 years. So we're pretty far ahead of the curve. I'd say that Massachusetts is the only state that's ahead of us, thanks to Governor Romney.
Mm-hmm. And, you know, one thing I think about when we watch some of these fights from the outside is we tend to see party politics better than interest group politics because it plays out in public. So we see Governor Nikki Haley go to CPAC. We see her go on TV to appeal to conservative voters. But presumably she and all governors are going to have health care providers streaming into their office, and particularly the hospitals who've been outspoken on this, saying, you have to take this money. You can't leave us out in the cold here, right?
That is what's going to happen. Although South Carolina, when I was campaigning for president, I said this on David Gregory's show yesterday. When I was campaigning for president, we figured that South Carolina's gross domestic product would increase by 2% if they just had the same Medicaid program Vermont did. I mean, this is just stupidity if governors refuse this, because not only does it boost their health care sector and insure a lot of people, it raises their gross domestic product because it increases spending by the private sector and the hospital sector in every aspect of the state's economy. Now, Texas is going to, I don't care who the governor in Texas is, they're going to take this money. It's $52 billion. And they have a really sophisticated network of hospitals, probably the 3rd or 4th most sophisticated in the whole country. And they're one of the real meccas of American medicine. If you think that the governor, whoever it is, Republican or Democrat, is going to be able to turn down $52 billion and not be eaten alive by places like Baylor and Houston Medical Center, you've got another thing coming. There's a payment called a disproportionate share payment that is made to states to help them pay for uncompensated care. With every state except Louisiana, that payment disappears. So these hospitals are going to take it on the chin, and states with great medical establishments like Texas are going to be left into being second-class citizens if the governor doesn't take that money, and I think they will.
Yeah, I think you're right about that. But to be fair to them, one argument some of these governors have made is that, sure, the law says it'll match at 90% beginning in 2020, but in 2 decades, Congress could vote that down to 85% or 75% or 55%, and then the state is left holding the bag. How likely do you think that would be?
Well, look, in 2 decades, every nuclear power plant in Texas could blow up, and I don't see them getting rid of their nuclear power plants. This is a ridiculous argument. If that happens, they deal with it when it happens. It hasn't happened yet. There's been talk about it for years. The truth is the governors, when they pull together, which they used to do before 1994 and the Republican Revolution, governors are a powerful force in this country, and the match has been very, very good. South Carolina gets an 80% match. For Nikki Haley not to take that 80% from the federal government is gubernatorial malpractice. It just is. I mean, that's a hell of a lot of money coming into a state that isn't doing so well. And they could do a lot better. And the same with Mississippi and Louisiana and all those states that are all, they're in the 40s in all the indicators of child health and adult health and so forth and so on. It's a ridiculous thing to do. There's no reason for them to be in the position they're in. And with some leadership in the governor's office, they wouldn't have to be with this program. Look, I wasn't a big supporter of Obama's bill, but it's the law of the land. We might as well work with it. And I'm willing to work with the parts I don't like. And I think it's about time the Republicans grow up a little and start working with the parts they don't like.
Former Democratic National Committee Chairman and Governor of Vermont, Dr. Howard Dean, thank you very much for being here tonight.
Thank you.
Ahead, the behind-the-scenes drama that led to last week's Supreme Court decision. Dahlia Withwick will join us with all the details next. Plus, because we don't mess around with small stuff here, we have a moment of geek featuring nothing less than the secrets of the cosmos. That's still ahead.